Hey, everybody. So I will give it a second for you guys to just get in here. This will not be a very long live. I just want to give you a little bit of update. Some things I can talk about, some things I'm not, but I do just want to kind of share some things with you so everybody kind of knows where we are. We're heading into Christmas. And so, you have a couple of things happening with that, right? So I just want to kind of give you guys some of that information and then wish you guys a Merry Christmas. And then we probably won't talk again until maybe after Christmas. So I just want to kind of give you guys an update. Hey, Vernon. Hey, Christy. How is everybody? You guys doing all right? So just giving you some good, yummy goodness and some updates, okay? Over the last, I would say over the last week and a half, especially the last week, I've gotten a lot of information, really good information when it comes to Ballad Health and what we needed, right? And so I have to give you all some kudos because what I asked several of you to do was I asked for you to step up and I asked for you to be brave and I asked for you to send me things that were evidence, things that were supporting documents, things that we could literally use. Hey, David. And that's what I was looking for because although my heart goes out when I hear the stories, right, without evidence, without documentation, without things that we can prove, it's just stories. And so that's what I was interested in. Hey, Lee. Hey, Barbara. Hey, Vernon. How are you? Hey, Deborah. Happy holidays. Merry Christmas to everybody. So I want to just tell you some things that have happened. So on December 13th, if you guys remember that live that we did, it was just full of yummy goodness, and I was very excited that Commissioner Dreisner had issued a letter to Ballad Health and to Alan Levine stating that while Ballad had sent 3 letters regarding the downgrading of the level 3 NICU, that those letters had been pretty general in nature. They lacked specificity, and the health department was saying, listen, the 90 days has not started. We are requesting this information, and I believe it was 14 bullets of information that they wanted, and they said, listen, until we get this and anything else that we deem necessary, we're not even going to start the 90-day clock. Now, what was really, really awesome about the end of that letter is he said something really important. He said, please be advised, any action taken by Ballad Health to implement this downgrading of the NICU would be considered a violation of the terms of certification. What I will tell you is that yesterday and today, because I got follow-up information today, yesterday I sent a very detailed letter to Jeff Ackerman, to Judy Connect, to Commissioner Dreisner, to the Attorney General's office, specifically showing actions that had been taken by Ballad Health to implement the downgrading of that level 3 NICU and moving the facility and the staff to Johnson City. And I produced that information with, that was text messages and emails from Ballad Health management to people in the NICU and people in positions to implement transition, okay? And I was able to send that information to the state health department. Okay, so I haven't gotten a response back from them yet, and I didn't expect to because I sent it late on a Friday afternoon. But what I do believe is, here's what I know for sure. I did get an email from them that said the Allendale move was being reviewed by their legal counsel. Like, that's literally what the email that I got back from them said. And then somebody else, and I believe it was Christina, who sent the information to the Virginia Health Department. She got an email back from them or from someone on the Virginia side who said, listen, we are aware. We are looking into pay cuts. We are looking into the moving of the Allendale Center. We are looking into all of those things. It is under review right now. So I want you all to know that we do, in fact, have attention and a lot of eyes and ears on this thing. And I do believe that we have more than just stories. We have evidence. We have fact-based documents that support the things that we are saying Ballad Health has been attempting to do. So that's great, right? Now, the thing that I said yesterday when I said it's been a very big day, that it was a good day for the cause, I can't share it with you yet. here's what I will tell you. With every fiber of my being, I am supremely confident that this next piece of information is going to cause the state health department and the Attorney General's office to take action. They will have no other choice but to do so. And so I'm pretty excited about that, because what I'm fairly certain of at this point is that this third piece that I have that actually involves what I'm pretty confident of. I'm choosing my words very, very carefully. This last piece of evidence, and it's undisputable evidence. It's like you can't even question it. It involves what I believe to be at least 2, potentially 3 violations of the terms of certification. Like no BS, like 3 violations in one thing. So what I believe we will have is 4, potentially 5 very specific violations of the terms of certification. And so here's what I'm going to ask you all to start to do. I'm going to ask you all to start to think about, what do you want to create in terms of your healthcare system? I'm going to ask you to start to think about if they go back and say, we need to modify this COPA, because I believe that that's going to be the first step. From the way that I understand the COPA, it says, even though it says that the COPA can be terminated, what it says is that if modifications have failed. Okay, so my thought process is that modifications are what's going to happen first. So what I would like to see is, I would like to see some of the physicians, I would like to see some of the nurses, some of the other clinical staff, some of the folks who work at, Allendale, some of the folks who work at hospice, some of the folks who work at different facilities, to start to outline what are the things that you've noticed since this merger that you believe to be a disadvantage to the public and a disadvantage to the employees, and what would be a viable solution, right? Okay, but so understand, Chris, those are different things. Rusty Crowe, that's an ethics violation. And that's between him and the United States Senate committee, right? That doesn't violate the COPA. Neither does Starfish Health. Those are ethics violations, right? And those are things that we've taken up with the governor's office and and I did not use the Tennessee Ethics Committee. I went straight to the U.S. Senate Ethics Committee. So those are 2 different things. Does that make sense? So I want us to be clear about the 2 different avenues, okay? So what we have is you've got some ethics violations, right? And conflicts of interest from people that are in certain positions, whether that's Commissioner Dreisner, whether that's Rusty Crowe, whether that's Gary Hicks, whether that's Ron Ramsey, whoever those people are. That's one side, right? And that has to be dealt with over here. But then we have actions that are taken that specifically violate the terms of certification for the COPA. And that's what we're talking about when we talk about Allendale, or when we talk about things that they've done to go ahead and start downgrading or transitioning the NICU. So those things have to be dealt with on that side of the house, okay? So here's the thing, David. I know that we think it was working just fine the way that it was basically, but we've talked about this before. The reality is we're not going to get back the 2 separate hospital systems that we had before, because they don't exist. Wellmont does not exist anymore. Mountain States Health Alliance does not exist anymore in the state that they were before the merger took place. So what we have to start to do is say, okay, what do those things look like? Because there's gonna be 2 choices. If they terminate this COPA, which I believe that that's further down the line and I'm not sure is going to happen. But if they did terminate the COPA, you would have to understand that you're not going to get those 2 hospital systems back the way that they were. They no longer exist. What does it look like? What does the potential look like for someone to come in from the outside to purchase them and to do different things? So that's one thing, but I believe in my heart that that's a little bit further down the road. I think what we look at now is you look at the COPA, the terms of certification. And this is where I'm going to ask you guys to do a little bit of due diligence. I'm going to ask you to read a little bit, and maybe that's something that we can start to do on these lives. Maybe we can start to take a look at the terms of certification itself. Maybe I can start to read some of them, like different sections. Like there's a section regarding employee termination. And so like I sent an email to Jeff Ackerman quoting the terms of certification, because it says that employees can't be terminated within 24 months of the COPA being issued except for cause. Well, my question was, what does the state health department and the attorney general mean by for cause if you're working in an at-will state? Because an at-will state doesn't really have cause, right? So I wanted to know how were they defining cause in this document? Because without a definition of what cause is, you don't know if it's being violated, right? So, and I'm still waiting on an answer for that particular question. He told me that he had to get with legal because he got with them the first time. I came back with a follow-up answer, and he's going back to legal to give me another answer. So I'm still waiting to get that. And so Ketron, that's perfect. So this is what we're talking about, right? So what we would want to know from the community and from staff, right? From patients and from staff, what are the modifications that we think have to be honored in order for us to have a workable relationship? We have to have a workable relationship with our healthcare system, our state government, and the community. Like, we have to find some common ground. So what does that look like? I firmly in my heart believe that in the next 9 to 10 days, we are going to be in a position to be able to say to the state health department and to the attorney general's office, hey, these are the things that we want modified in this COPA. And you know what I would recommend is asking for everything the first go around, right? I would say asking for everything that you want this first go around, and then starting the negotiation process, and the state being able to come back and say, hey, this is what we do want, this is what we can do, this is what we can't do, this is what we don't think, this is what we do think, and then being able to have that negotiation process. I don't know how that's going to work because I don't know that the public has had a voice. From what I've seen, the COPA oversight people haven't been your voice, which they should have been, right? My thought process, my thought when I first read it, is whoever the COPA oversight is, they were the people that were supposed to be protecting your interests. And I don't see that happening, right? You know what I'm saying? So those are the things that you know, that I would want to see kind of addressed and say, okay, well, how do we make sure that that's happening? I'm not sure, Park, tell me what you mean by the $1 billion conduit. Kind of expound upon that for me, if you don't mind. That would be helpful for me. But this is what I'm saying. So here's what I would love to see happening at this point is I would love to see, like, the nurses, the physicians, and the patients in the communities. Maybe what I can do is I can put together the same way I put up the registration for the potential nurses union. What I could do is I could create an online form for you guys, right? I can create an online form for you guys. I'm not sure, Park. I'm not sure, right? And I think that that's a byproduct of something else that would have to be addressed. You know what I'm saying? Yeah, I think that I don't have the answer to that, because what I've been focused on is the actual terms of certification, the actual handling of the COPA, because the bottom line is like whoever had that money, it belongs to Ballad, right? Because whether it was Wellmont, whether it was, you know, Misha, whoever, like Ballad Health has it now, would be my thought process, right? So maybe if you want to articulate and put down some specifics to that and send it to me, then that would be fine, right? That would be fine with me, so that I can read it and give you some additional information. But for right now, this is my belief, right? Is because of the violations that we have been able to document, not throw accusations out, but literally document. I believe that, you know, you guys are going to be in a very strong position to say, hey, this COPA has to be modified. And, you know, and one of the areas that I think would need to be modified is the COPA oversight. I think that there needs to be something different in there about who oversees this COPA. What does oversight consist of? Because it's obvious that the way it was outlined the first go around, Ballad Health has no regard for it, right? They have no regard for the process of how things were going to be done. And the things that they agreed to do, they have not done. And so I think the state has to pay attention to that, because basically Ballad has looked at the state and said, I ain't scared of you. I'm going to do whatever I want to do. And so I think, you know, there has to be some parameters, and maybe there has to be some punishments involved. So, you know, let's just say that, you know, the state, rather than just say this will be a violation of the terms of certification, what's the penalty for a violation? I think there has to be a penalty in place. Okay, Ballad Health, if you just want to do whatever you want to do, you want to disregard the process, and you want to, you know, overstep your bounds in the terms that we agreed on, then maybe there's a fine. Then maybe there's a fee. Maybe there's something that happens. You know what I'm saying? That makes them a little more cautious. Like, well, hell, we might not want to do that if it's going to cost us money. You know what I mean? Maybe violations are tied to the bonuses of the executives. You know, maybe that happens. I don't really know. I do definitely think that you all have to kind of say, all right, we don't have anybody, from what I can tell, you all don't have anybody who is making sure that the things that are being done are for your best interest. And those things aren't stipulated in the COPA in a way that is enforceable. I don't believe that information is being passed along in a expedited manner, right? The same way that you should have a right to a speedy trial. I believe that it shouldn't take 3 or 4 months for people to get wind of the changes that have been made. I think that people need to be aware up front. You know, I believe, now here's the other thing that I do believe. I do believe that we need to have Gary Hicks, and since he stood in Hawkins County, Gary Hicks stood in Hawkins County, and he said, listen, if there's something that needs to be righted, if we need to fix something that was done earlier, I'm willing to do that, right? So check this out. I would call Gary Hicks' bluff. I would pick up the phone, I would email Gary Hicks, and I would say, hey, the same way that you sponsored HB 2020 that turned into SB 2048 that allows Ballad Health to hide all of this information, we want you to sponsor an amendment to that bill that only allows certain business practices and certain business information to be private. And we want you to sponsor an amendment to that bill that allows things like deletions, repurposing, eliminations of services, and things like that to be made public, and that it outlines a formula for how that has to be done, right? So I believe that we should have them sponsor an amendment to those existing bills, guys, and be able to say, hey, listen, this is all that you are going to be able to keep private, and the things that you must tell us, this is the manner in which you must tell us. We must know so many days in advance. We must know, it must be communicated in this form or fashion. Because right now, the way that they get around a lot of things is that they just put out a news release, like a little news article, and if you happen to not read it that day, then you just don't know. And Donna, I agree that the union piece may be a great thing for staff and for nurses, right? But the union is not going to impact patients, right? So I think that there's a lot of different avenues to this puzzle, and this is where everybody needs to start getting on one accord, folks. Right? Everybody has to start kind of coming together and saying, okay, so what are the things that we need to be able to do? Gotcha? So I wanted to give you all an update and tell you that, hey, this is the information that was sent yesterday. The information that was sent yesterday shows clear evidence that, according to the letter that Commissioner Dreisner put out on the 13th, Ballad Health is in violation of the terms of certification, period, right? There is something coming soon that's even kind of bigger than that and undisputable in terms of its evidence. And so that's going to be coming over the next little bit. With the holiday coming up this week, it's going to take a few more days than normal to make sure that everything is rolled out the way that it needs to, and that information is processed and given the way that it needs to be, but it's definitely viable. I have also requested via the Freedom of Information Act, I have asked specifically to know the number of non-salary union eligible nurses at each of Ballad's facilities. And the reason why is we know that we have to have a certain percentage of the votes in order for a union to pass. So in order to know what that number is, we need to know how many people work there. And that's something that because of SB 2048, Ballad doesn't have to tell us unless we request it. So I requested it, okay? So that's where we are right now. I've requested that information about the number of nurses. They have been provided evidence regarding Allendale and the NICU that clearly shows a violation of the terms of certification. I have requested information about the definition of cause when it comes to employment to be able to determine another piece that could be a violation of the terms of certification. And I have another piece of documentation and evidence that is in my possession currently right now that is being, it has already been vetted. Let me just say that. It has already been vetted. But there is supporting information coming along with it that, I mean, by itself alone, it stands, right? But what I would like to do is, even though it stands very strongly all by itself, I would like to apply a couple of other things to support it all the way around so that it can be done. All employees, so here's the thing, Ketron, not all employees can be union, because if they're salaried and different things like that, then they don't qualify. Right? So that's the first thing. The reason why I specifically said nurses, hold on a second. The reason why I said nurses is because that's who originally asked me about this. And so we need to start to look at what can we get past, what can we get done? You know what I mean? Hold on. The public did not know anything except what we hear on the news. Right. So Kathy, and here's the thing. So that's why I want to know, what is cause? When we know that people did lose their jobs, who lost their jobs? So let me just tell you this. It says that because of this merger, people, if positions were deleted or whatever, people could be offered another position that is up to 30 miles away from where they currently are. And that's not considered a violation of the COPA. Okay. Sorry guys, my knees are hurting me. So I'm waiting to see about that. I've heard about some other things, and I'm waiting to get the rest of those pieces together, okay? So that's pretty much the update. Those are the things that I wanted to tell you. I know you guys have been like, well, when is Danny gonna give us an update? When are we gonna find out about some of this yummy goodness? I just have to hold close to the vest until I get it all in place, because I wanna do it right. I want it to be effective, and I want it to have the result that we want it to have. I want you all to get busy. This is now time to get out of bitching mode. This is now time to get out of complaining mode. This is now time to stop talking about how bad Ballad is and what have they done. Because we got it now, right? We got it. We have evidence. Now it's time to say, what do we want our healthcare system to look like? With Ballad and without Ballad. If there are going to be modifications of the COPA, then let's talk about what those things are. Let's talk about, what do the terms of certification say, and how does that sit with you guys, right? That's the process that has to be made. Right, Lori, it's action time. And I'm excited about this because I really do. I wouldn't get on here and tell you to start thinking this way if I wasn't pretty sure that we're in a position where the state is going to have to take some action. I really do believe that the Department of Health and the Attorney General's office is going to have to do something. Okay, I really do believe that. So, you know, I'm starting to say, okay, so what does this look like? My concern is that we need to, when they start to modify this COPA, someone is going to have to be at the table for you. That's my thought process. Maybe you all don't agree, and I'm okay if you don't agree. Just in my brain, when I'm thinking this thing out, I'm going, okay, because this is just the way that I feel about it. I feel like no one was at the table for you the first go around. I feel like the state health department, the Attorney General, and Ballad Health, they did it by themselves the first go around, along with your politicians, and it didn't work out so well. Right? So my thought process is, all right, if it were me, I would want someone at the table to be able to say, no, we don't agree, you know, and be able to say, okay, these are the modifications that this group wants, and that this group wants, and that this group wants. And so maybe these are the things that we want, and to be able to do that. So, Okay, so in all transparency, I've asked myself, because I've had people say that to me, and I've had to ask myself, would I be willing to do that? And what would that look like in my life? Right? What would that look like in my life? And so I will say this, as far as I've thought about it right now in this moment, the answer would be yes, I would be willing to do that. The other answer would be the state would have to pay me to do that. not because I'll tell you why. Because I have to live like everybody else, right? And it would be time consuming to do. It's already time consuming at this level, right? To take on that piece of it, it would be significant in my life. I would be willing to do it, right? I just wouldn't, it would need to make sense for me as well. Does that make sense? Fair is fair. So we're not there yet. Let's just kind of take this thing one thing at a time. What I will absolutely do for you guys is I will create a form that is online. And what it's going to have is some very specific questions about what do you need to do so let's just say, like, what would the modifications look like? What would we want? And I don't want to say what are the demands, because that's not really what I want. What I would want to say is, what are the things, how do we cooperate and do this together? You know what I mean? How do we cooperate and do this together, right? And so for me, cooperation looks like, okay, let's look at the board of directors. Who stays and who goes? Who do we want to put on there? I have told you before that I would like to see at least 3 physicians on that board, and I would like to see at least 1 nurse on the board, right? I understand the need for executives and things like that. I also believe that there has to be some medical folks in there, and I believe that there has to be people who have taken an oath to care about the health and well-being and to do no harm. So those are some things that I believe would be a good thing to do. You know what I mean, in terms of the board. And so that's what I think about. So things like that. So when we look at it and say, okay, so what would we like to see? What would make you feel okay? What would get you on the path to rebuilding your relationship with Ballad Health and with the state of Tennessee? What would it take to get us on the path? Because right now there's no trust. There's no trust because, you know, Commissioner Dreiser's wife gets paid by Ballad Health, right? From several different businesses, from, you know, Senior Life Solutions, from all of those different things, right? So I think that there's a different, so thinking about all of those different things, okay? So that's the stuff that I want you guys to start thinking about. So for nurses, right? Okay, do you want your differentials? What do you want in addition to this base pay thing that's happened, right? All of those different things, those are the things. So I will create an online form for you where you all can start to kind of put down your thoughts about what you want it to look like. Understand you're not going to get everything that you ask for, you know. I definitely understand that. I think we have to think about, what does it take to monetarily save our hospitals and practice good health care for the community? You know what I mean? That's what I think. That's the place where I'm at now. How do we, you know, look at those 2 things overall? And that's what I think is the most important. Stacey, so what I've done is given people information. In the past week, we've been able to provide documentation that shows 2 clear violations for the terms of certification. And the newest piece of information that I got yesterday has already been vetted, has already been verified, is absolutely 100% solid. But there's additional supporting stuff coming along with it. So I'm waiting until I get it, and I'm waiting until I contact a few other people, because this last piece is big, and And I believe it's going to have some serious, like we've had some ripple effects. I believe that this is going to cause like some big waves, and I want to make sure that it's done correctly, and so that it accomplishes what we want. You know what I mean? Right. So Kim, so that's the thing. So we got to start talking about how do we make what are attractive offers for nursing, right? Right. Competitive service pricing, competitive wages, those types of things. And then here's the other conversation. So I'll tell you the information, guys, that I alluded to the other night, and I didn't really go into detail, but here's my understanding. And listen to me say, this is my understanding of what I've read so far. My understanding is that when it comes to the day surgery centers, like Kingsport Day Surgery, right, and Holston Valley Day Surgeries, those facilities are no longer going to be managed by Ballad Health. They have entered into a merger, an agreement with a company called USPI, which is a national company. And in doing so, here's what's going to happen. And my understanding is that this is effective January 1st. So if you are scheduled for a day surgery, an outpatient day surgery at one of those centers, you might want to pay attention and ask some questions, because this is my understanding. 70% of the community is Medicaid or Medicare insured. And those plans don't pay the same amount for a surgery done in Kingsport as they would pay for that same surgery done in Atlanta. So if you were having a surgery done in Kingsport and that same surgery was being done in Atlanta, they would be willing to pay differently. They would pay more for the same surgery being done in Atlanta because the cost of living is different here, the population is different here, all of those different things, okay? So listen, so what will happen now is, because Ballad Health will no longer be managing those day surgery centers and USPI will, well, USPI has a national payer rate, a national payer contract rate. So that means they will get to charge more for those surgeries, okay? Now, here's the thing, Medicaid's not gonna pay anymore. Medicaid is pretty much, they're gonna pay the same, that's my understanding. So where's that difference gonna fall? That difference is going to fall to the patient to pay. So a surgery where prior, you know, your out-of-pocket expense may have been small, right? Then I'm not talking about Indian Path, I'm talking about day surgery centers, guys. You gotta stay with me, I'm talking about day surgery centers, okay? So the difference is gonna be paid by the patient, but they will be able to charge more for these surgeries because they're going to be done through and built through USPI, which is a national payer. That's my understanding, okay? So just giving y'all that piece of information. All right, so again, it's time for us to start to say, okay, what do we want it to look like, and what are we going to focus on? The biggest pieces of this is around Medicare, okay, not Medicaid. It's around Medicare, Medicare, TRICARE, those programs. But I just need for you guys to kind of understand the concept here, okay? So hopefully this has been informational. You guys have gotten a chance to kind of get up to speed about where we are, start to thinking about what are the things that really make sense in terms of a healthcare perspective, and understanding that right now it is about how are we going to be able to move forward once we get the brakes fully pumped on where we are right now. That's the big question, okay? So those are the things that I'm going to be asking you guys, and I promise that over the next few days I will put together a form where you guys can go in and start to put that information in, okay? Is that helpful? Hopefully that's helpful. All right. Okay, 1 week. Gosh, is it 1 week? It is. It's 1 week from today. I don't know for sure, Faye. The only thing that I know is that it's the day surgery centers. That's my understanding. So Diana, that's another thing that I've heard about, and here's the challenge, is that I haven't been given documentation. So here's what I can tell you that's been said to me. What I can tell you is that people have gone to the emergency room people have gone to have procedures done, and the physicians at the hospital, so say for example, the hospital is in network, but the doctor in the emergency room isn't in network, which I don't know how the person would know that or not. So the person is getting billed an out of network charge for a physician that is working in an in-network hospital. And what I have seen happen is employees, doctors who were employed directly by Ballad Health at a particular hospital are now no longer employed directly by Ballad Health. And I'm not saying this is all of them, guys. I'm just telling you that I've seen evidence of this. And they are now employed through Schumacher Physicians Group. Schumacher Physicians or Schumacher Clinical Partners. And basically what's happening is these doctors are now contracted by a Ballad employee to work in the same emergency rooms that they were previously working at before. And what happens is now they are no longer they may not be an in-network doctor. And when that occurs, or they could be locum tenens doctors, and if that occurs and they are not considered to be in network, then you may get an extra bill, like I've heard of a bill for $1,000 for a doctor who was practicing in the emergency room of an in-network hospital, but the doctor was an out-of-network doctor. So, you know, I don't know too many people who go to the emergency room and go, hey, wait a minute, you're at this hospital that's in my network, but are you in my network? So that may be a question that you might have to start asking for right now. You know what I mean? So, yeah, so just giving you guys some of that information, okay? So I will say this, if you have information for me, not just your theories, not just even your stories, even if they're true, folks, even if they're true, I need documentation to go with them. So I need you to be willing to go get your bills. I need you to be willing to go get your medical records. I need you to be willing to put in some time and effort, folks. I need you to be willing to do that, okay? I still need you to be emailing and calling the State Health Department and the Attorney General's office and COPA oversight. And we still need to be asking. So here's one of my big asks, and this is important. And it would be great if you guys would pass this around. I want Commissioner Dreisner to issue a letter to Ballad Health the same way he did about the NICU. And I want him to issue a letter about Bristol Regional Medical Center's trauma center, because Bristol Regional Medical Trauma Center has not been, was not pre-approved by the COPA, right? So I think that somehow it's getting lost in the mix, and it's a big deal for Bristol to go from a level 2 to a level 3 trauma center. So Commissioner Dreisner needs to be sending out a letter the same way he did about the NICU, about Bristol Regional Medical Center being downgraded to a level 3 because it has not been pre-approved. So those are important things. So we need to be asking for that. A letter from Commissioner Dreisner saying, hey, Ballad Health, we have not given you permission to downgrade Bristol's trauma center. And until you give us documentation so that we can, you know, review all of it and give you either approval or disapproval, then, you know, don't take any action where that's concerned, right? Also requesting that the annual COPA review be done locally. I do not believe that it should be a burden on the patients and the people of the region to try to figure out how to travel to Nashville, how to pay for hotel rooms, and how to make your voices and your concerns known regarding, you know, your health care. I just believe that, you know, hey, state, you created the situation. So state, you come to the local region and hear what the people have to say about the changes that are being made. Hey, Megan, got it? So those are the things. So let me just recap before I go, okay? So first thing, Gary Hicks, we want you to sponsor an amendment to HB 2020 that became SB 2048 that allows information in the COPA about repurposing, deletions, and changes of major components of service lines to be made available to the public. And we want that information to be made available at least 60 days in advance. and it has to be communicated. If there are patients directly affected by that service line change, then there needs to be an email communication or a letter mailed out to each of those people notifying them of that information. You all just putting that out a daggone press release or an article in the paper doesn't do it. So that's the first thing, you know, requiring that Gary Hicks, you know, sponsor legislation to amend SB 2048. COPA complaints need to be made available to the public. We deserve to see and hear the complaints that are being made. They should not be allowed to be kept private, right? Things of those nature. So that's one. Two, requesting that the review of the COPA happen locally rather than all the way in Nashville, so that more people in the community have an opportunity to make their voice heard, right? Number three, we want a letter. The same way that Commissioner Dreisner put out a letter about the level 3 NICU downgrade, he needs to put out a letter regarding the Bristol Regional Medical Center the trauma center downgrade, because that wasn't included, that wasn't pre-approved in the COPA. That needs to happen, right? So requesting that as well. So that's a big ask. And then the big one is saying, hey, listen, State Health Department and Attorney General, Ballad Health, you have received documentation and information on at least 2 absolute violations of the terms of certification. So what we are going to ask that you do right now is to step in, issue an injunction, and prevent Ballad Health from making any more changes or any more plans, right? So stop all their planning and stop all their implementation until an investigation has been opened and all of their plans laid out in detail, and those plans have a chance to be turned over to the public, and there's a hearing about them. So those are the things. Those things right there, folks, are the things that we need to be demanding, okay? Not demanding, but firmly requesting. How does that sound? So anyway, I just wanted to give you guys that information and let you know that there is something in addition that will be coming out very, very soon. Still working hard on this end. I may have gone back to Atlanta, but I have not left you. And I will be back next week. So whatever you do, come out to the rally, folks. The rally is going to be 1 week from today at 4:30 p.m. at the Kingsport Farmers Market at the indoor facility. Please be there. I will be there. Dr. Spivey will be there. And some other folks will be coming to share information with you, to answer questions about the COPA, to answer questions about services and things like that. Just, you know, whatever information that we can give you that could be helpful. Okay. All right. So that's it. I'm going to go. You guys have a Merry, Merry Christmas if I don't talk to you before then. And y'all know how I end this thing, right? And let me just say this. I am hopeful, guys, that even in our differences and our disagreeing on different issues outside of Ballad, that it creates a space that we can actually hear each other, even if we disagree. I would love to be able to have that space where someone can share something with me that I might not have thought of before, and it makes me go, maybe, you know what I mean? And just be able to have conversations and discussions without it being bickering and arguing, because that's not productive. I want the relationship and this space to be a productive space, no matter what we're talking about. So whether that's Ballad Health or anything else, you know? So hopefully you guys can understand that and can appreciate and respect that. And I'm out. So be amazing, be light, be love. Peace.